Today we're going to discuss the importance of public knowledge and use of AEDs immediately following cardiac arrest. Seattle's King County has spread the use of AEDs to the public since 1998 and have a cardiac arrest survival rate of over 50%. The national average ranges from 2 to 25%. If we spread the use of AEDs to our local communities and beyond, together we can all increase the chances of loved ones surviving tremendously by one simple act. According to the AHA, as of 2013, the national survival rate for cardiac arrest is 9.5%. The most common reason for this is simply a lack of knowledge when using an AED in a public setting. Another big reason for these poor outcomes is in general, people are not trained on basic first aid. Anyone that can read and follow simple instructions can help. According to the National Institute of Health, over 1/3 of people treated with an AED in a public setting have survived. Seattle's King County has a goal to have an AED in every street corner in the city. They have also developed a program with the general public in which they offer AED and CPR classes. Anybody can take them, and when you're done, you are trained and certified to use an AED and perform CPR. The national average cardiac arrest survival rate has dropped over 2% in the last year alone. Most people watch movies and see someone dead on the streets, paramedics come to them, put a monitor on them, and they're in a flat line. The paramedic shocks them, they return to a heart rhythm, and life goes on. The truth is, your heart is actually not always stopped when you're in cardiac arrest. It can be in what is called ventricular fibrillations or ventricular tachycardia. These are actual shockable rhythms. When you place an AED on someone, it will identify this rhythm, and when shocked, essentially the heart will reset. Dr. Thomas Dressing of the Cleveland Clinic states that every minute that goes by in a cardiac arrest, someone not getting shocked by an AED, their chances of survival go down by 10%. When a person goes into cardiac arrest, they are, for lack of better terms, dead. Your heart is doing one of four things. Absolutely nothing. It has electroactivity but no blood flow. It's just fibrillating, or it's in ventricular tachycardia, which is an extremely fast rhythm that starts in the lower part of your heart. If left untreated, it will result in cardiac arrest. The American Heart Association reports that outside of the hospitals, people's survival rate are at 9.5%. When a person goes into cardiac arrest inside the hospital, it's all the way up to 25%. So you can see that if somebody is trained near an AED and somebody goes into cardiac arrest, their chances of surviving go up tremendously. Knowing that you contributed to the saving of someone's life is something that nobody can forget. The gratification of watching somebody die right before your eyes and coming back to life and walking out of the hospital is simply amazing. You have to remember, these people are like you and I. They have family and friends to go home to every single day. People can and actually do go back to the same quality of life, if not better. It serves as a wake-up call for most people and actually incorporate exercise programs or stop bad habits that cause them to go into cardiac arrest. Can you imagine if the national average was over 50%? You'd have a person who's able to go home and create memories with their family and friends still. We would all have the comfort of knowing that if we did suffer a cardiac arrest in a public setting, someone nearby would be trained to act. It's a win-win situation. With Seattle's survival rate over 50%, it's obvious by learning how to react, we can save somebody's life. The American Heart Association has developed what is called the chain of survival, which consists of early access to the emergency response system, early CPR, early use of an AED, and early care by EMS. By performing these simple acts, you're saving someone's life. King County's system is called Community Response CPR AED program, which was a law passed in 1998. By including the community in this program, they have maintained a survival rate of over 50% for multiple years. If we were to pass similar laws like this and get everyone on board together as a nation, we could have a survival rate of over 50%.